Chronic pain is a difficult one because if I walked into my doctor's office with a severed limb, it would be really clear that I was in pain. But because it's invisible and because I look okay on the outside, it's not as believable. So it's very isolating and it's very frustrating.
1 in 5 people in Alberta live with chronic pain that lasts for 3 months or longer. Over 80% of them have lived with chronic pain for 2 years or longer, and over 50% have lived with chronic pain for more than 10 years. And unfortunately, many of these patients have to actually fight for the care that they often don't receive.
I was feeling very suicidal and very frustrated with the chronic pain and not knowing what was happening, what was going on with my physical self. I was just so sick of healthcare professionals telling me that I'm imagining it.
Your world shrinks, and it just keeps shrinking and shrinking. People don't believe you. Oftentimes your physician doesn't believe you. Your family, your loved ones, your employer doesn't believe you. You feel judged, misunderstood. You just feel invisible, or maybe you want to become invisible.
When we live with pain for 3 months or longer, the pain system itself starts to change. It can cause that pain system to kick in, even when it's not useful.
Alberta Virtual Pain Program is a provincial program that offers easy access to care and support for patients and providers who care for patients with chronic pain. A lot of care can be provided virtually just as effectively as it can be done in person. So the Virtual Pain Program was envisioned to be that service that addresses the gaps with no waiting time, no referral needed, no formal diagnosis of chronic pain needed, and feel that they are heard and that they are respected and that their needs are met. One of the unique things about the Virtual Pain Program, and I think actually one of the key elements to its success, is that it has been informed by patients, it has been implemented with patients, and it has been co-designed with patients.
As patient advisors, we talked about the kinds of elements that we thought were important through the program. So the clinicians had their ideas, and they also asked us for our ideas, and so we spent a lot of time sort of prioritizing what we thought was most important and constantly asking us for our feedback and our recommendations.
Hi everybody, and welcome to your second peer support session.
We have a 6-week program with 2 sessions a week. One is a content session with facilitators and clinicians, and the second session is a peer support session with a peer support worker. Peer support really helps people be more open about their experiences. People feel more comfortable when they know that somebody has been through something like them. They understand that they're not alone in what they're going through.
The peer support aspect of it was important for me because I knew that they suffered with chronic pain as well, and it wasn't just academic knowledge of chronic pain, it was real lived experience.
Well, what I love about this program is the transformation that happens when they say, I used to be afraid to move, but now when I move, I tell myself that I'm sore, but I'm safe. They have this aha moment, which is so amazing to watch.
If I had had access to the Alberta Virtual Pain Program, I would not have felt guilty and embarrassed about being in the situation that I was in. I don't think I would have had to go to the depths of despair that I did to have the courage to move forward. And I was fortunate that I found some strategies that worked well for me.
With the Virtual Pain Program, patients don't have to fight for accessing care. They don't have to justify that they need that support. Patients feel heard, supported, and they learn tools to navigate their chronic pain journey even after the program is done, helping them to get the services that they need.
The program helped me to pursue a lifelong desire for a craft. So for the last few years, I've been making handmade soap, and I love it, and it's great because my energy levels can change from day to day, and I can kind of work around that. So it's the perfect hobby for me, and I love it. Learning how to cope with chronic pain has helped me to live my life for me. I'm really grateful for it. The pain program really helped me.